As part of efforts to support the response to COVID-19 in Nigeria, in June 2020, our organization, 360 Degree Network, in collaboration with SINAC Medic, applied for the One Young World COVID-19 Intervention Fund. Our application was approved and the grant had been made available to us. Part of this grant, we are going to be procuring personal protective equipment, which include face shield, face mask, as well as hand gloves to nurses, doctors, healthcare workers across different stages of management of COVID-19 in Nigeria. Today, we are at the London Professional Training Center, where we are hosting healthcare professionals to a fully sponsored infection prevention and control training sponsored by the One Young World Foundation.
That we'll be able to do. After this training, the purpose is that you should be able to train your one out of one person in one hospital or two out of 100 people, right, in a particular hospital. Watch me as I do it. You place it on top of the ridge of your nose, connect it to the ear, one loop, connect this side to the ear, one loop. Then use your hands, your two hands, starting from here, form a bridge. Mold it to conform with your nose setting, right? Drag this other side downwards towards the chin area and you have it molded perfectly. Like I will do this on loop and without touching the surface. My name is Mrs. Nkiru Kalkafo. I'm the facilitator for today's event, infection prevention control training. The training came up because we felt that we assessed a skill gap in the healthcare workers in Nigeria currently, and using Lagos State as a case study, where we noticed that people are not complying to the infection control practices that they have for maintaining with what we have now in the pandemic with the coronavirus thing. So we felt, okay, we could do a partnership with 360 Degree, that's LPTC, London Professional Training Center, and 360 Degree Services to have that training capacity building for healthcare workers, in Lagos State. And with that, we had to call some of them to have the infection prevention control training so that they can go back and also train others to be able to have that. We feel that the only way we can attack this coronavirus is by having healthcare workers know what their role is in terms of doing that to play. Thank you. Wet your hands using the water. Take the soap. Produce a good lather. Rub it very well. Good. 3. Rub the palm of the hand and ensure your fingertips. Rub with fingers interlocked. 5. Okay? Pick this one. It will come like this. Right? I'll roll it onto this hand to open up. Then you can trash. We have a dustbin there. Exactly. Which of the following is not a barrier to infection control? Not a barrier. Which of the following is not a staff responsibility? Okay? Okay, thank you for your time. Thank you.
My name is Odisha Fistaiwo. I got to know about this webinar online, on LinkedIn actually, and I registered for it. So I actually had the mind of coming to learn, of course, the new way to go about things, and since the webinar is about infection prevention and control, to learn, relearn and unlearn the old ideas I had about things and the new way to go about it. And the class has actually been very exciting, educating, and the tutor is actually very nice, and she carried everyone along.
I'm Oluwapo Michael. I'm glad to be part of this training. I was greatly impacted. I actually got to know about the training on social media. I've met a lot of people, and I hope to see more of this. I'll go back to my center and I'll try to teach as many as I can. Thank you, LPTC London Professional Training Center. Thank you.
We are saying a big thank you to One Young God Foundation for coming to support Nigeria at this time where we have scarcity of personal protective equipment and where we have lack of time to provide training for healthcare workers across different areas of the healthcare system. Thank you very much.